So maybe let's start now. Thanks so much for joining this webinar. The title of this webinar is Webinar on COVID-19 Welfare Challenges and Response. It's organized by the ICSW Northeast Asia region. And my name is FURUICHI. I'm the president of the Northeast Asia region. And I'm glad that we have 6 speakers from 4 of our members sharing their experience, their wisdom with us. So each of the speakers will speak for 12 minutes. And our Korean friend will speak in Korea, and then there will be simultaneous interpretation. So if you stay at the English channel, you should be able to listen to the interpretation. And as said earlier, if you have any question, you can input in the chat box, or you can raise your hands, and during the Q&A time, I will invite you to speak. So maybe shall we start now? Our first speaker is Ms. Jang Shin. She's the Division Manager of Policy Research Division and Korean National Council on Social Welfare. She will speak on the direction of social welfare services in the post-COVID-19 era. But I think before Ms. Jang speak, I think the president of Korean National Council, Mr. Su, would like to also speak a few words to us. Mr. Su, are you here? You want to speak? Well, we will unmute you first. Hi, can you unmute Mr. Su? Yes, Mr. Su, your turn.
You can hear me, right?
Right.
Also, in terms of managing social welfare institutions. And our Director of Research, Ms. Young-Shin Chang, will talk about a little more details on this subject. Ms. Chang?
Good afternoon and good morning, ladies and gentlemen. So, my name is Young-Shin. Offer service in post-COVID-19 in Korea, and also what will be the social service measures in the future. I'm going to use my 12 minutes. So when you look at the status of Korea, so as after the declaration of the pandemic by WHO, as of July 20, worldwide, as 12 million people are infected, 14 million people are infected in Korea. We have a first, the confirmed cases in February, and also 296 people were killed. So under this situation, Korea CDC, classified the 4 different stages. So that is the warning, and also caution, and also threat, and also the serious. So February 24, Korea entered the serious cases. In the serious cases, we divided into 3 stages. First one is that the distancing in daily life, and the second stage is the social distancing, and third one is the enhanced social distancing. With these the stages, we are responding to COVID-19. First, so by July 2022, we started the distancing in daily life, and also there are certain exceptions under this situation. See 50 people confirmed cases per daily. That is the for distancing in daily life. And also by May 20, we also experienced social distancing here. So probably the operations, we do the partial operating, and private sector are advised to refrain from operating and restrictions in industries. And also for the enhanced social distancing, we did the from March to the May. So here, infection prevention, economic activities in parallel, transition to distancing in daily life. So 73.5 people were also on leave and also July 10, release of recommendation said that close social welfare facilities. And from July 20, there is a pilot operation for social welfare facilities. So some will be resumed in the Central Korea and also the local areas. Under this situation in Korea government, we are also created the TF task force to effectively respond to the current situation. And we have 18 different facilities or organizations under Korea KNCSW. I believe that they have a certain importance in terms of providing the social service. So March 20, we created the task forces. Let me share the specific content. So 2 rounds of the TF proposal to the welfare, Ministry of Health and Welfare. So some of them were already reflected in the policy, and also Prime Minister, Deputy Prime Minister for Economic Affairs and Minister of Health and Welfare. We always submitted a recommendation for overcoming COVID-19 crisis. It's related to the emergency, with that, the basic subsidies and also the assistance have been provided to Korean people. And also we created manuals for against COVID-19. This was distributed to all of different facilities. And also for the social welfare facilities, 1.6 billion worth of the sanitizer and 300,000 masks were distributed. In particular, the Daegu and Gyeongbu area, the isolation or the lockdown was implemented from March. So for that, we provided a support. So KNCSW has been doing the sharing services, which include the food bank and others. So we provided emergency food pack to this affected area, and also 440 facilities. We also provided the volunteer services for the homes which were heavily affected by the COVID-19. And the social service delivery system is not very strong under this situation. So we need to strengthen our existing services and also develop new services for the second wave of the COVID-19. So that's why we need to prepare right now. Lastly, I would like to share the new direction of a social welfare service. First one is we need to go to the people. So our social services should be changed to the consumer-based. So we need to provide a continuous social services for these needy people. And under this gesture, we need to continuously provide services for vulnerable people, which means that we need to go to their place and help them. And also the second part is establishing online welfare service by convergence with ICT, information and communication technology. So we need to strengthen our technology to provide better services. For example, online consulting and online safety net building, and also online training for the elderly. So various the education and welfare services should be developed depending on the situation in the local area. And also digital platform should be an important venue for us to provide the social services. Third one is that we need to industrialize social services. So social service has a different nature, different from others, and also it created a very big and great the job creation effect. So current COVID-19 make people lose their jobs. So we need to create more jobs for these people. Since 2005, the job increase, 42% of job increase from the social service sector. And social service sector, it has a greater added value, 1.3% higher than the manufacturing sector. So social service will create an added value, which will boost the economy and also social welfare. So this should be strengthened. Fourth one is we need to strengthen our entrepreneurship. So after COVID-19, Korea's diagnosis kit has been exported to worldwide, and also drive-through and innovative the means have been created by Korean people. This will be also greater strength and competitiveness for social service facility. And also social service people should focus on entrepreneurship in a desperate way, because as a changing environment with the COVID-19, we need to be very much sensitive to change. So we need to find opportunities, and these opportunities will be created by the innovative thought that is going to lead to the new value creation. Last thing we want to go to in a new direction is that the develop a Korean social service model. So social service should see the people whether comply with the hygiene and other the important principle against COVID-19. In our social service sector, we need to develop more personal and the human resources and the intangible resources a lot in our social service. So we have this Korean social service asset. This will be developed into the one that can be shared by international society. That's all. Thank you very much.
Thank you very much, Ms. Chan. And Ms. Chan has shared with us the how the Korean Council and also the Korean sector try to respond to the COVID-19 and in various directions. So we can, well, if you have questions, you can raise afterwards. Now we will come to the second speaker, Mr. FURUICHI. He's the Vice President of Japan National Council of Social Welfare. He was also the former Vice President of National Hospital Organization. And Mr. FURUICHI will speak on the measures against COVID-19 pandemic by the Japanese government and also the welfare sector. So FURUICHI-san, your turn now.
Thank you,
Mr. CHUA. Hello, everyone. My name is Kenichi, and I'm the Vice President of Japan National Council of Social Welfare. Today, I would like to talk about the current situation of COVID-19 pandemic in Japan and our measures against it. At first, before the COVID-19 pandemic, the main social welfare issues in Japan were how to support long-term care, child care, people with disabilities, needy people caused by the structural change of social economy, such as declining birth rate and aging population, low economic growth, etc. Japanese government focused on social security reform and social welfare reform as the core political issues, and was to arrange social security reform for all generations to make better balance of benefit and burden. In the summer of 2020, looking at 2040, when the aging of Japanese population reaches the peak. Unfortunately, COVID-19 outbreak and its disease characteristics suddenly break all socio-economic, medical, social welfare works in Japan. First slide, for situation of the infection, and the total number of the infected is now over 30,000, and the number of the dead is over 1,000. As of today, the total number of the infected is 31,203, and the number of the dead is 1,012. Next slide, please. Since January 2020, Japanese government has proceeded the infection control measures and in April, declare a state of emergency. Under this declaration, various measures were taken, such as self-restraint request of economic activities or going out, strict disease control, etc. On the other hand, CHUA improvement of medical care provision system, guidance for medical institutions or social welfare institutions about disease control, economic or employment measures, etc. As a result, on May 25th, the declaration of a state of emergency was cancelled. However, the infection of COVID-19 has been expanded again in July, and no one knows when it will end. Japanese government accumulated 60 trillion yen at the supplementary budget to cover the expenses for countermeasures and is now tackling both disease control and listed of socio-economic activities. Next slide, please. Our initiatives to face the spread of COVID-19, JANG requested so many things to Japanese government so many times, such as to strengthen the disease control measures necessary for the continuation of social welfare service, or to strengthen the support of poverty issues caused by the self-restraints of socio-economic activities, etc. As a result, requested issue could have a necessary budget. It is a satisfactory outcome. Next slide, please. Even now, the infection in social welfare institutions has not stopped. Other issues such as lack of hygienic materials such as masks or disinfectant, fatigue or lowered motivation of social welfare workers due to long working hours, rumor damage against facilities where infection occurred still remain. Bankruptcy of home care service providers is another serious problem. To ensure the safety and security of social welfare workers, service providers, and users, and to continue social welfare service, JANG will continue to collect information about on-site challenges and will request the systematic measures to the government intermittently. Next slide. From now on, it will become indispensable to provide social welfare service on the premise of infection prevention of COVID-19. It will be a must for social welfare service providers to make a crisis management method in case of an outbreak of COVID-19 among users or workers. The way of information disclosure should be set in advance. Next, please. Council of Social Welfare in Prefectures, 47. and municipal councils of social welfare, 1,800, all over Japan, implemented the welfare life fund loan service for people affected by unemployment or suspension of business because of COVID-19 to help them get back their independent life again. The scale of economic crisis is greater than that of a Lehman shock. Next. This slide shows the support activities and measures in heavy rain disasters occurred in January, just for your reference. Please, final slide. Thank you. All social welfare practitioners, Japanese government, and enterprises should unite to support many and various people struggling with poverty due to COVID-19 and help their independence. Perhaps it will take a long time. We must be precautious against COVID-19 infection, and subsequently, the way of providing social welfare service will be changing, as well as the socio-economic activities will be. Yet, even the way of providing services changed. The substance of social welfare is unchanged. We should not forget the spirit of social welfare to realize a society where everyone can live with dignity, where bounds between people are kept, and so where mutual support among people is maintained. In February 2020, JNCSW formulated Social Welfare Vision 2020 and decided to work together with the social welfare practitioners, related organizations, community, residents all over Japan towards the realization of the prosperous welfare society where we live together. The NCSW will cope with the issue of COVID-19, including it in this vision as well. Cooperating with social welfare workers in Northeast Asia region, the NCSW will face COVID-19 as the foundation of the society and overcome it finally. Thank you.
Thank you very much, Furuichi-san. Thank you. Thank you for sharing with us the experience, the measures taken by the Japanese government and also the Japanese Council. So our first speaker will be from Hong Kong, Professor Terry Lam. He's the head of the Department of Social Work and Social Administration of the University of Hong Kong. He will speak especially the experience of Hong Kong's welfare sector in dealing with COVID-19 in residential care setting. So Professor Lam, your time.
Okay, thank you, Hai. So everyone, thank you for giving me this opportunity to share. So my share will be more focusing on elderly care services, which is an area that I know most. And I also know that other speaker from Hong Kong will also talk a little bit more in the community side of elderly services. So I will focus more on the residential side of elderly services. Next slide, please. But before that, let me give you some statistics about COVID-19 in Hong Kong. So we have been doing quite well until this month. So up to now, so our first case in Hong Kong COVID-19 started in mid-January. It was an imported case. So until up to now, we have, as of today, we have 2,885 confirmed case, which is, you know, not a big number compared with a lot of other cities that has more than 7 million people. So out of 7 million people, physically right next to mainland China. So I think we have been doing quite well until really recently. You know, amongst them, we have 24 people are killed by the virus. So the fatality rate is less than 1%, which is also quite good. So until now, actually until July, we do not have any confirmed case in nursing home or in OH home. So that is also a kind of something doing extremely well. But unfortunately, we start to having cases in nursing home started from this month. And then also give you some example of how bad it was once the virus get into nursing home. For example, in Hong Kong case, the first nursing home that get confirmed with COVID-19. So we jumped from one confirmed case, you know, in day one, and then to 32 in the third day. So in 2 days, you know, it jumped from one case to 32. And as of now, it is about 3 weeks after the first confirmed case. We have 92% of all residents in that nursing home confirmed with infection. And then we also have, let me see, we also have 9 staff members and 2 family members confirmed with the infection. And then for older people who were confirmed with the infection, the fatality rate was 15%. So 15% of all older people, you know, are infected with the COVID-19 from that nursing home were killed, compared with less than 1%, you know, in the general public. So you see, once the COVID-19 get into a nursing home, how bad it can be, right? Internationally, about 40 to 18% of all people killed by COVID-19 in the Western developed country are nursing home residents. So in Canada, it is about 82% of all people killed by COVID-19 nursing home residents. In UK, it was 47%. So it is extremely important to prevent the COVID-19 to get into nursing home. So why so, right? Why nursing homes are so bad? The major reason is it is a good living environment. And then people share common space, and then they live in a congested area. Second one is the residents are usually very frail, and then they have multiple chronic conditions, medical conditions that need a lot of medical attention. So in 2003 in Hong Kong, we learned a really big bad lesson from SARS. So in Hong Kong, what we found out is the nursing home residents is about 5 times more likely to get infection with the SARS virus compared with the general public. And then once they get infected, they are much more likely to be admitted to intensive care and to be put on mechanical ventilator. And then once they were on mechanical ventilator, they will be on ventilator for a long time. That means if they get infected, they will very quickly use up all the, you know, intensive care capacity and the mechanical ventilator. This was exactly what happened in Italy as well as, you know, in other European countries. And it eventually led to the collapse of the healthcare system. So if we were able to prevent, you know, the older people from getting infection, actually it will save, you know, the healthcare system. And then, you know, in Hong Kong situation, the SARS virus has much more high fertility rates. 79% of all nursing home residents who get infected by SARS were killed by the virus. But in the COVID-19, the current number in Hong Kong is 15%. And then another statistic from SARS is 81% of older people get infected from nursing home, get infected. They were infected through their connection with hospital. So the first line of defense to prevent is to cut down the connection between hospital and you know, our nursing home. So right now, there is an article I published in the Journal of Aging and Social Policy that documents the lesson we learned from SARS and how it has been applied to nursing home. Next slide, please. So because of that experience, Hong Kong has been doing extremely well at the past until July to prevent the virus get into nursing home. So the standard procedure we did are pretty much also used by other countries. For example, we stopped all visitation as early as late January. At that time, we only have several cases, confirmed cases in Hong Kong, but the nursing home, private or public, they already stopped all outside visit. And then the government, the hospital authority in Hong Kong also stopped all non-essential medical appointments so that they cut down the visitation of nursing home residents to hospital and then bring back the virus. And then we have very strict hygiene patterns, for example, face masks, hand hygiene, and then we also practice social isolation. So, the other side of this line is a new policy guideline come out from the WHO. It was issued on 24th of July of 2020, so just a few days ago. So I was one of the experts invited by the WHO to prepare this policy guideline. And so in the next slide, I will talk about the recommendations from this policy guideline and how does it affect the welfare sector. But basically, from our experience, there are some challenges that we need to face. The first one is people with dementia, they deteriorate rapidly under the social isolation because of lack of stimulation from outside, as well as lack of stimulation within the nursing home. So this is something we see an unintended consequence due to COVID-19. The second one is end-of-life care in care home or in nursing home is also a big problem, even a problem in hospital. So people who are dying in hospital, but they are not allowed to have family visitation, the family member are not allowed to see their loved one passing away. So this becomes another major issue, particularly in Asian society, which, a filial piety, respecting the elder become a big issue. I am quite sure it also happens in other Asian society. And then the staff shortage, because of, staff get sick, get ill, they don't come to work. And then they magnify the staff shortage. And for some nursing homes, the staff they use temporary staff, which work in several nursing homes. But once they get infected, they bring the virus to several nursing homes. So those are the challenges we are facing in nursing home sector. Next slide, please. So if you look at the slide, the right-hand side of the slide, these are the 11 recommendations from the WHO on the new policy guideline. And the WHO policy brief can be downloaded from the WHO website. So you can just search, for the policy brief, and then you can download it. And then they have this is a summary of the 11 recommendations from the WHO. And then some of them, the number 1, number 2, number 3, which is related to welfare policy. So the number 1 is include long-term care in all phases in the national response to COVID-19 epidemic. As I say, in most countries, developed economy, 40 to 80% of people get killed by the virus are from nursing home. So including nursing home care in all phases are extremely important. The second one is mobilizing adequate funding for long-term care to respond to recovery from the COVID-19 pandemic, and then ensure effective monitoring and evaluation of the impact of COVID-19 on long-term care. So COVID-19 may come and go, but the long-term impact of the resident has not been known. So how does it affect their long-term health and mental health trajectory? Is not something we don't know. How does it affect the welfare spending on long-term care in both nursing home as well as home and community-based setting is not known. So those are the welfare response, policy response to COVID-19. And then we have social services administration response to COVID-19. So including number 4 to number 7. For example, number 4, secure staff and resources, including adequate health workforce and health products to respond to COVID-19. So I'm not going to kind of go into detail of each one, but I would strongly recommend, the participant to really take a look at that document, particularly, the 11 recommendations, and see how the government and the welfare sector can respond to those, recommendations. And then we have number 8 and number 9 are the direct social care response, including provide support for family and voluntary caregiver, prioritize the psychosocial well-being of people receiving and providing long-term care services. We cannot ignore the staff who are providing the welfare or the long-term care in this setting. And then the last two is the system reform on better medical social collaboration. So we cannot fight the virus alone. We need a medical social collaboration. Next slide, please. So these are the kind of, indication from the 11 recommendations. The first one is the social welfare sector. We need to work with our governments to initiate and implement this recommendation. So we need to make sure the government know about this recommendation. We need to make sure the government will put this recommendation into top priority. The second one is, in the midst of public health crisis, the voices of disadvantaged population. It can be older person in nursing home, it can be ethnic minority, it can be people with disability. They are usually being ignored. So we need to make sure their voices are being heard, in the COVID-19 pandemic. We are talking about their life, we are talking about their well-being, and their voice need to be heard. And then the government itself cannot do it alone. So we need a very strong private, public, and don't forget about the philanthropic partnership. So we talk about the 4 Ps, the public, private, philanthropic partnership. So that is extremely important to, because COVID-19 is not going to go out very soon. So we need a more kind of, it is a marathon, it is a long war. So we need the partnership between the private, public, and the charitable community. So next slide, please. So I just share with you a little bit on the innovation, services innovation that we did. So we talked about the people with dementia, they suffer because of social isolation. The adult daycare center, the adult center gets shut down. So they cannot receive a typical, regular, cognitive stimulating activities from the center. So this is one of the NGO partner we have in Hong Kong. So they use online method to provide cognitive stimulating therapies to the person with dementia. So CST, cognitive stimulating therapy, is the standard evidence-based non-pharmacological intervention for older people with dementia. So it is recommended by the NICE guideline in UK. So over 80% of all UK elderly, services, they use CST, as a standard protocol. But under COVID-19, it is very extremely difficult to deliver this one. So NGO are trying to use the online system to deliver the CST. I was told the effectiveness was about 40% compared with the face-to-face delivery. However, that was because we are using the online to deliver the face-to-face, methodology. So if we want to have an effective online delivery, we need to redesign the whole services delivery system. So we cannot just move the thing that we used to deliver face-to-face into the online mode. So with that kind of mechanism, we only get about less than 50% of effectiveness. So we need to totally redesign the whole services delivery. So next slide, please. So we also, another message I want to share with you is older people are in fact more resilient than expected. So we partner with 15 NGOs in 10 districts. So we give a very quick screening of 3,446 older people. So we look into their mental health. So what we found out actually, their mental health is really not that bad. So only about 8% of older people we call has, passed the threshold of depression. So we worry about anxiety, we worry about depression. But in fact, the number is not higher than a typical, or a figure or benchmark before the COVID-19. So, but in Hong Kong, the good thing was we have a quite vibrant civil society. We also found out, in the month of February, it was not good, but started from March and then April, it's getting better and better, mainly because a lot of NGO, although they cannot have face-to-face services, they mobilize a large army of volunteers. They call the older people, the face mask, the hand sanitizer, to the older people in need. So for example, and the whole society get mobilized. So for example, even in my university, we get donation of face masks and hand sanitizer. My research team, we deliver more than 10,000 face masks and hand sanitizer to older people in need. So these are how the whole society get equipped. So this is my last slide. So the next one is just a thank you. Next one, please.
Thank you.
So thank you so much.
Thank you, Professor Lam. Thanks a lot for sharing so many different kinds of practices in the welfare sector and also the WHO experience and guidelines. And the next speaker will be Mr. Wenliang Chen, who is the Secretary General of the Association of Digital Culture Taiwan. Mr. Chen will talk on the impact of COVID-19 to the NGO or NPO sector in Taiwan. But before Mr. Chen speaks, I understand that the president of ICSW Taiwan, Professor Joyce Fan, would also like to speak to us for a minute. So, Professor Fan, your time.
Yes. Okay, President Chai, thank you so much for organizing this webinar. I think this is quite in time, good opportunity for us to share our experiences. And I didn't really prepare a report, but since Highway just told me a few minutes ago, give me 1 minute to make a brief report on Taiwan. So I really, I can make 3 comments on the pandemic now and what's happening under the pandemic in Taiwan. First of all, I have to say overall, in Taiwan, we have a pretty good record about the less confirmed and the cases and the less death cases. Due to, well, the government told us our Ministry of Health and Social Welfare adopt early preventive measures, which are pretty much like what Professor Terry Lum just told us. So the checklist provided by WHO should be confirmed now by Taiwan cases that they worked. So besides the governmental policies, I think there are 3 reasons Taiwan's pandemic cases is a better looking one. First of all, I think we really have a very good national health insurance system, which support a well-allocated healthcare system and public health education. So people in Taiwan are educated about the importance of self-care, self-health management, especially we have the experience from the SARS pandemic in 2003 that really engraved in our memories. Therefore, we can see now the policy of social distance, isolation are well kept. You see face masked people everywhere. Even young people can obey this policy, which is really regarded as very useful or very effective behavior, health behavior. And the third one is, I think, just as what Terry just told us, nursing home is a very, how to say, high risk area. 80% of deaths are from the nursing home residents, elderly residents. And in Taiwan, we adopt community-based elderly and long-term care service policy. So we have a relatively fewer number of nursing homes. And for those few number of nursing homes are well monitored and managed during the COVID-19 pandemic period. So I think that's why we don't have, and I really agree with Terry's observation that we found out the elderly people have very high level of resilience in this kind of disaster or pandemic. But the pandemic did heavily impact our economy and social behaviors. So we are especially concerned about the impact to NGOs in the third sector and the international communications. Therefore, later on, we invite Mr. Chen to report on some NPO survey results and Mr. Yan from CHUA Foundation to report on CHUA Foundation's local and cross-regional service during the COVID-19. Thank you so much.
Thank you, Joyce. Then now, Mr. Chen, your turn. I can't hear Mr. Chen.
William. He was there. William.
Yes, I saw him.
Yeah, I saw him.
Mr. Chen. I can't hear you, Mr. Chen. Sorry for the technical problem. Can you try again?
Hello?
Yes, yes.
Okay.
Okay.
You hear? Okay.
Yes,
Good.
yes. Good.
Well, okay. The report is based on two different surveys of local media. One is the new media operated by us. Next slide, please. Okay. MPost is the new media on philanthropy informations. So run by us. And we serve the research. It's a survey during late April and mid-May, and there are 158 respondents from this survey. And the other one is a local magazine called the Global View magazine. And this is a survey done by the magazine and 7-Eleven Taiwan with the MPOs founded by 7-Eleven's CSR program during mid-May. So there are 50-some organizations responded to the survey. And as a result, let's see, next please. The negative impact according to the survey listed from top down, the most frequent listed is the decline of funding. People are worried about the decline of funding because of the economic impact due to the COVID-19. And then the nonprofit organizations have to force to change the way of service delivery because the limitation of a large number gathering to prevent community infection. And then much of them have to cut down some services or suspend certain services to avoid person-to-person contact. And then, of course, volunteer services, which is usually a replacement or very supportive service to many NGOs, are decreased or they have to suspend it due to personal protection measures. And the increase of operational cost for protection measures like sanitizers or face masks and all the protection gowns that are very costly, and for organizations who have residents, they have it almost on a hourly basis or a daily basis. So it's a huge number of costs. And decrease of gifts in kind, which is also due to the personal protection measures. So those are the negative impacts that are perceived by nonprofit organizations here. Next, please. And the top 5 coping strategy that are adopted by nonprofit organizations during this period of time, we think is very helpful to control the vulnerable group from being infected in Taiwan. Personal health protection measures, new way of operation or service delivery, like online visits, or they can work with the individuals, clients through smartphone or mobile devices. And of course, suspend or cut down services to prevent infection, and then provide procedures for this new norms, like they have to open only one exit to measure personal temperature and all that protection measures. And of course, for the organizations that are not provide the direct services, they have work from home arrangement or rotation shift to just precaution from maybe the group infection measures. Next. But the major concern, given the fact that Taiwan is one of the least countries have better control on COVID-19 infection, the economic impact unavoidable because of the global economy basically have impacts. So in the first quarter, 31% of the organization, 70% decline of donation in the first quarter. And then they estimate at least 56% of the organizations responded that another 20% decline would happen in the second quarter. So we will see what happened from the financial report this year. Next. And there are 83% of the social service organizations responded that during the pandemic period of time, it's very hard for them to marketing or communication than ever. So that's what we call the infodemic victims. A lot of information about COVID-19 and including fake news and all the information that need to be clarified. So it's very hard for nonprofit organizations to do whatever they usually did to campaigning or fundraising informations like in the past. So as a result, from these two surveys, we found three insights. Basically, in our survey, we found that there are much more worries over facts. Whenever there are economic impact, anything happened, usually when a reporter, a journalist interview the CEO or director of communication of nonprofit organizations, the standard answer will be, yes, we have impact. But if you look at the financial report, sometimes and almost frequently, we can see not as much impact as they planned during the interview. So we still have to double check with the financial report of the organization who claims that they have economic impact during the pandemic. And but if the global economy continuously have negative impact by the pandemic, then it could happen to the nonprofit organizations as a result of the fundraising because of the donors' pocket is shrinking, and of course they don't have spare money to give to the nonprofit organizations. The second one is the organizational health matters. Because the major shift of the services or new measures that we have to adopt to prevent further infection or to protect our residents or clients that we receiving our services, larger nonprofit organizations usually survives better than the smaller or medium ones. That's one of the Taiwan's uniqueness. We have a lot of small and medium-sized NGOs or associations or a smaller group of people provide very community-based services around the island. And they don't have a better cash flow like those who are bigger, who have a larger funded or reserve fund for emergency needs. So it really point out that we need to look at the organizational health on the cash flow or operation. And then, of course, that leads to another issue. Investment for organizational development is very important. With whichever size of the organization is, this is a very important issue that we need to invest. And that does create a lot of awareness from many organizations during this period of time. And the third one is digital transformation helps. We found that usually, especially among the nonprofit organizations, digital investment is something difficult for top management to put it as a priority, because usually they will say this is too expensive in terms of the use of the resources and it's not usually the priority. And of course, that it has to do with how they perceive digital development is. Some leadership will say, okay, let's purchase a couple more computers where we have internet connections, let's have our own server to make sure that our information are well protected. But digital maturity means more than that. Not just equipment, is about how we collect information and make it into useful data, and then to improve the service delivery process and our records, and then those digital informations could feedback to the decision-making process in order to improve the organizational health. So that's another thing. During this period of time, a lot of organizations start to think about how mature our organization is in terms of the digital development very seriously during this period of time. Online service or provide digital devices for marginalized people, like Professor Long just mentioned. They have to learn, then they will be well included during this period of time. So I think this is something that are very important for us to reconsider, especially in our region. Digital devices typically manufactured here and assembled here, and we export it to other part of the world. So this should not be in things to invest, but it will be very efficient for us to develop in the near future, especially in the case of the COVID-19. So conclusion that I think we are next, please. We do, just like Professor Fan just mentioned, Taiwan learned hard lessons during 2003 in SARS. So we are lucky enough, knock the wood, we are least challenged so far by COVID-19, but also we are least tested in terms of our system, medical system, and social service system, that if we have to face larger number of infected people, are we ready or not? This is something we're not tested yet, and we better not to be tested, but we have to ask ourselves whether we are ready or not. And I think that's something we need to think about and learn from other parts of the world, especially for countries who have learned lessons this time. So that's, I think, what Taiwan is doing in the nonprofit sector. Thank you.
Thank you, Mr. Chen. Thank you so much. Thanks for sharing the survey findings among NPOs. Actually, I'm quite surprised to see the results because, as you said, Taiwan is kind of least challenged. The confirmed case is among the lowest, but I actually did not expect that NPOs receive so little donations during this period of time. So, I hope that the situation will improve. Actually, the Hong Kong NGOs also face similar problems, and all our fundraising activities in these 6 months were all stopped. So NGOs also face similar problems. Well, the next speaker, Mr. Chen earlier mentioned about the use of online or mobile devices. And the next speaker, Mr. Billy Lau, he's the Service Director of Elderly Service Evangelical Lutheran Church Social Service Hong Kong. Mr. Lau will also speak how they use smart home care solution during this time of COVID-19 and try to change or to serve the elderly people. Now it's your turn, Billy.
Thank you, Mr. Chua. And this is Billy from the Evangelical Lutheran Church Social Service. And I am a social work practitioner for specialized in home care services. So today I'd like to share something that is very practical and how to use ICT in our services. And yeah, let me share my slide. So, well, especially in COVID time, it's very difficult for us. But before that, we find that our home care service, well, we have a little bit difficulties and when we see the future of Hong Kong. So you can see the aging problem of Hong Kong and the present population served by the home care services here. So the orange thing. And then after that, the future service needs is 8 times from now. So can we just have 8 times of social workers doing the same thing in the future? Can we have other solution? And we have a decrease of workforce and of course the most important, the most serious problem is that we can see the elderly people, they're idling at home. So under the consent of our users, we've taken a video like this. So you can see an old gentleman, and he's staying at home. And before he's retired, he's the owner of a bicycle shop, and he's a professional cyclist. So you can see all the way he's sleeping, and you can just see the fan moving until our staff came. Now this is our staff. So when she left, this old gentleman sleep again. And then here come his wife, walk around, and then they sleep together. So you can see, this is already very bad. And every week we have, every day we have our worker going up to their places to give services, but how can we beat the other 23 hours? They're just leaving. So it's even worse when it's locked down. So, so in 2016, we started this project. So here is something that I would like to show in a video. So this is in Cantonese, so I do some simultaneous interpretation. So this old lady is using our system. So when she finished her work, she used our system on a tablet computer. So watching Cantonese opera. So in the tablet, we have something like a YouTube that is installed inside. So this old lady is recording the old days using the vinyl record. So every day, every afternoon, she use this tablet for 1 hour, test the blood pressure and temperature, and to see if there's something special in the schedule, and play the games. This is the cognitive games. We designed very well, have local taste. So this cognitive games has 6 domains, and it's a failure-free design. She's very happy with that. So this old lady again is testing the blood pressure. This is kind of Internet of Things, connecting the blood pressure meter and connect it with the tablet. There's no need to write it down again. Everything is inside the tablet. And our physiotherapist will prescribe exercises, especially for each client. So this is the warm-up. So we invited many famous people to take the videos and design exercises for them. This lady said, and after the works, she sit down and play the games. So after the game, when she feels boring, she go to see the movie. Life is much easier with the tablet. So I can use it anytime. Very convenient. So this is a great project that's supported by the Hong Kong Jockey Club. So you can see ladies are very happy. And this live reactivation system has 4 components. So first of all, is telehealth. So since 2016, we've purchased 356 sets of Android tablet, and with IoT device now using by seniors. So they can be monitored by themselves, and we have some apps can be used by the care staffs and the caregivers. So when the elderly, they have the readings, so it will simultaneously synchronize with all the apps. So every people concerning the elderly can read it. And we have tele-rehabilitation. So what we call just like the brain training system. It's just like what Dr. Lam said, and when the isolation time, they have a lack of stimulation. So we try to give some stimulation for them. The game, we have 30 games in 6 domains, and we have a database of 81 exercises, video clips, and 61 greeting and encouragement videos. So we rewrite all the exercise illustration also, so it's make it more clear for the prescription. And of course, scheduling is very important, especially in the pandemic time. And well, in the pandemic time, if you don't have any, you just pass day by day, hour by hour. So we try to have an actual scheduling system and encourage people to be active. So basically in the system, we have encouraged already 70,000 meaningful hours for the engagement of the elderly already. And of course, we have the social network that more than 700 seniors are engaging now. So we have some cases. So this is the case of Madam Shui. So Madam Shui is a 73-year-old lady, and she's a home care user, and she got stroke for 3 times, hypertension, gout, and well, many others disease or illness, long-term illness, and she has intermittent inconstancies. But she's very active with our life reactivation system. You can see in the picture. And beside the system itself, we use video conferencing or video calls as a subsidy, or to use side by side with the LR system, so that we can have some more interactive way to provide our service. This kind of tele-intervention. So Madam Shui has used these services for 9 months, and she learned very fast. And just like what Dr. Lam said, sometimes their resilience is much better than we thought. And she learned very fast, just 2 lessons, she learned how to use that and can handle it very freely. And she's engaged for 3 to 4 hours per day with that system. And she measures her physiological data. It's especially important to measure her temperature, body temperature. And bring up app, that is the cognitive games, she do it every day, and do exercise every day, and she loved to have video entertainment, the old Cantonese movies, San Ma Zai, and news, etc. And in the meantime, she is interviewed by the media. So you can see she's on the media. And it's important to have a feedback system like this. Sorry. Yeah. So in the lower right-hand corner, you can see the radar. So each spike of the radar means that the score Madam Shui played in the cognitive game. So our therapist can see how she performed and then prescribe different stimulation for her. So originally we plan or we designed this life reactivation system is for the elderly, but interestingly enough, or not interesting is not good, but anyway, we try to utilize this with our staff also. So not long before, there's an infection cluster identified in a public housing block in Sha Tin, in Lok Chun House, in a public housing estate, where our cases are living, and some of the staff were working and residing there also. So we have to provide the service also, but for those who have been working there, we have to have some quarantine for them. And it is a good way, it's a good time to try to use that to monitor our staffs also when the quarantine time. So we use them we use this system for monitoring our staffs. So they take the temperature at their home, and then we can see that the data is synchronized across the apps, so that we can see how things goes, and then we can monitor very closely. So this is one system that put into the elderly's house, and then we can use it in many ways. And this is very important that we can just put it inside into the house, and then we can have a lot of possibility inside it. So it is very important that we have to stay active and stay connected, and keep on the bond between people. And well, we try to keep our life go on in this pandemic time, to be more inclusive, to be more connected, and to be more active. So this is what I wanted to share. Thank you very much.
Thank you, Billy. Thank you for your sharing. As we see, your organization has started to develop this system 4 years ago.
Yeah. And
of course, obviously, it's not because of the pandemic, but because there's a vision that we should start some kind of new delivery model in view of the aging population. And thank you for your sharing. So our last speaker will be Mr. Po Wing Yan. Mr. Yan, he's the CEO of GG Charity Foundation Taiwan. And he will also speak on his foundation's response to the pandemic. He will also share a global views too. So Mr. Yan, your time.
Thank you, Mr. Tra, and hello, everyone. I'm Paul Yan, CEO of Global Security Foundation. I would like to thank you, especially Professor Joyce Fan from National Taiwan University, for inviting me to talk about CHUA's response to COVID-19. You know that Taiwan is only around 130 kilometers off the coast of mainland China. And due to its proximity to business relationship with mainland China, Taiwan was expected to have the second largest number of cases of coronavirus pandemic. CHUA is one of the largest faith organizations, NGO organization in Taiwan. So our founder, Former Master Chen Yan, her guidance, we took very rapid action in working with our government to help minimize the risk of COVID-19 transmission. We quickly mobilized our volunteers in Taiwan to make a face mask and breathe here. And together with our master in abroad, the Hualien County, the spiritual home of CHUA volunteers, we provided PPE to frontline responders of 20 central governmental organizations in the very beginning of the coronavirus outbreak.
Mr. Yan, Mr.
Yes.
Yan, I'm sorry, can you speak closer to the mic? We cannot hear so clearly.
Okay.
Yeah, thank you.
So we provide a PPE to frontline responders of 24 central governmental organizations. That is including custom administration and Coast Guard administration and Region Police Bureau and so forth. We also provided the blessing bags to many local governments, including Taipei City and New Taipei Prefecture, for those people who were in a quarantine period. And the blessing bag contains multi-grain powders, ready-to-eat meal, instant food like instant rice or noodle, nutritional supplements, books, and more importantly, a letter from our venerable Master Chen Yan. In total, we provided more than 42,000 blessing bags to 13 city and county governments in Taiwan. And we, Taiwan government and people, just like Professor Fan just mentioned, and the other speaker from Taiwan, we took the lesson seriously from SARS in 2003. In our coronavirus prevention measures, like wearing face masks, washing our hands frequently, keep social distance strictly, stay at home, and etc. So Taiwan is seen as one of the few places in the world who has successfully stemmed the spread of the coronavirus without resorting to drastic measures. Thus, the outcome of Taiwan's coronavirus pandemic prevention measures, according to the Newsweek Japan, the study of think tank institutes to Japan government. Taiwan is on the top of the best countries' response to COVID-19 prevention in the world. CHUA is also an international NGO organization. We have CHUA volunteers and contact points in 63 countries or territories in the world. In the first 3 months since COVID-19 outbreak originating from Wuhan, China, CHUA volunteers around the world proactively purchase PPE materials from those countries or territories not yet affected by COVID-19 to help China and Northeast Asia countries and territories in need. After the COVID-19 situation being brought under control, China and Northeast countries and territories in turn started to help provide PPE to other countries or territories in many European countries and even United States. This is a virtuous cycle of goodness, as our Dharma Master Zhen Yan often addresses. So as of July 28th, CHUA volunteers around the world have reached out for PPE support, including more than 10 million surgical masks and over 8.5 million medical gloves and etc. to 78 countries or territories. And there are 8 more countries or territories are on the halfway of our PPT support. So how can CHUA's PPE support be executed so fast and so effectively during the world lockdown policy implemented by many countries? Here are some points I would like to share with you. Firstly, private sector, we work with the health care departments and frontline responders and epidemic prevention workers. And also the private sector, we work with PPE factories. We even support our volunteers to help to make the face mask. And we work with logistics companies, like the transportation companies. We also work with enterprise CSR organizations to solicit their resources to work together to support the PPE materials. We also work with faith-based organizations like the Vatican City Pharmacy Bureau. We support the Vatican more than 60,000 surgical face masks. We also work with San Camilo Catholic Church organization, especially in North Italy, and then later on, Indian. We also work with Caritas organization. We also support and work with Mother Teresa House to support those medical equipment and necessities. We also work with UN and NGO organizations like UNHCR, NDM, is a medical professional organization, like a border doctor organization. We also work with Red Cross. So how we decide which country or territories or states or cities, well, we can even go down to very specific. we should support during this chaotic situation of coronavirus pandemic. The key elements of our consideration are the seriousness of local infection, the level of shortage on PPE, the request for PPE help, and CHUA volunteers' accessibility, and the risk of anti-money laundering and anti-terrorist. We need to evaluate those factors to decide which area we want to support. And have we encountered any difficulties or troubles on worldwide PPE support? Yes, we did, a lot. Due to the different time zone and languages of CHUA volunteers around the world, because our staff in headquarters have been working around the clock in the past 6 months on connecting all the resources and logistics to make it happen. For example, the PPE purchase. In the very beginning stage, we spent a lot of time to confirm the material spec with every different countries, and the time to check the supplier's credibility. And the material price is competing with many countries' governmental organizations, especially the size of the order they place is a 10 million size. And we, as a NGO organization, the size the order we place is around about 10,000 or 10,000 or 50,000 size, like a face mask. And in some cases, at the last minute, the supplier requests a cash transaction. That is also added some difficulty. We manage the PPE purchase. And also the PPE delivery is also challenges because due to the many countries implement the lockdown policy, or the airline company that cancel the flights, so that was also increase the insecurity of our PPE delivery. And also our volunteer availability for clearance and inland delivery. We need to manage to connect all those resources together. And also in some cases, we also face political reason. There are some country or face organization, the rejection of PPE support from certain country. What are the lessons learned from the COVID-19 pandemic? Though the COVID-19 pandemic is not yet over, or not even close to over, and actually in some country or territories, the COVID-19 even spreading faster than before. There are something we can do better, in my humble opinion. Like global partnership, mobilization, and cooperation among all NGO organizations. And together, United Nations organizations. And like previous speakers mentioned, the infodemic, the information transparency, and communication efficiency among those NGO organizations around the world is also challenges. And the global public-private resources collection, integration, and distribution, and the faith-based role and influence on separatism and xenophobia is also our focus. And we do see that there are lots of cases reported during the quarantine period, there are more violence, home violence occurred during the quarantine period.
Mr. Yen, one more minute.
Yes.
1 more minute.
Yes, no problem. So there are 5 ways, in our view, to prevent the coronavirus pandemic spread out. Procure and provide PPE where needed. Provide relief to the most vulnerable. Go vegetarian and educate people on those pandemic prevention measures. And pray with sincere piety. So that this is our last page. We encourage people to keeping one step ahead. From WHO on March 11th article, this is how coronavirus leads us to a vegan world. And I would like to quote Albert Einstein's saying that the clever person solves a problem, a wise person avoids it. So we believe vegan is the answer for all to prevent the coronavirus and protect our planet. Thank you very much.
Thank you, Mr. Yen. I think it's really amazing that your organization helps so many, not only cities in Taiwan, but also so many other places worldwide. Thank you so much.
Thank
now,
you.
Dear participants, we have about 10 minutes left. And as said at the very beginning, if you have questions, you can raise your hand or you can key in your questions in the chat box. Before the seminar, we have collected 4 questions from the participants. And I think our secretariat can show the 4 questions now. Is it possible? So the 6 speakers can, well, you can have a look and see if you can answer any of these questions. And in the meantime, I will see if any people have raised their hands or raise any questions in the chat box. So these questions I think are very meaningful, especially the first one, is about whether COVID-19, not COVID, is COVID-19 is a long-term situation. I think long-term we're talking about 1 or 2 years at least. And like in Hong Kong, Professor Lam said earlier, in the first 6 months, we only had about 1,000 confirmed cases. But within July, we have almost 1,500 more. So we, at some time, we think that the situation is controlled. But now we know that, it could become worse. So how about if we have a long-term situation? How can our services reach the users? And the second one is quite related, telepracticing. Can it be maintained? And then the third and fourth question is about any other specific suggestions for social workers during the pandemic. And the fourth is about the, I think it's online service. I think it is going to ask whether we can replace offline service by online service. So these are 4 questions. I'm not sure if any of our speakers would like to, share your views. And if you are thinking about these 4 questions, maybe I take some time to show a video to highlight what the Hong Kong Welfare Center has done during these 6 months. So you have some time to prepare for these questions. So after the video, then I will ask the speakers maybe we can give 1 minute for each speaker to answer to some of these questions. Okay.
新型冠狀病毒疫情雖然稍為緩和，但係對經濟民生已經造成重大打擊，失業同就業不足問題浮現。社聯嘅調查顯示，近90%受訪者因為失業或者工作縮減等等嘅因素，導致收入減少。如果基層家庭就要減少食物開支、子女學習費用，甚至要借錢嚟維持生活。所以社聯同企業同埋慈善基金合作，直接資助基層應付生活開支同劏房租金。同時，弱勢社群仍然缺乏防疫物資，社福同工努力搜羅社會資源，支援長者、小朋友、青少年、基層家庭、殘疾人士、無家者、少數族裔、照顧者、待業人士、精神病康復者同埋長期病患者。社聯同社福機構會繼續密切注視疫情發展，為有需要嘅家庭同埋人士提供適切支援。
So the video briefly highlight what our sector has done in the past 6 months, including donation of PPE and also the setting up of an emergency assistance fund for the disadvantaged. And so now we go back to the 4 questions. May I ask the speakers to share your views? Any speaker, Ms. Chan or FURUICHI-chan? Or anyone want to answer these questions? Or Professor Lam?
I think I can try the number 1. I mean, so far the response has been really top down. So a lot of the policy or practice are driven or prepared by the government or the professional. But if we are talking about long-term situation, I really think we should collect the wisdom, from the community, and then fine-tune those policy and make it workable, in the community. So far in Hong Kong, we saw a lot of examples that, the goodwill of the government or of the, professional lead to a lot of negative side effects. So I'm more thinking in the welfare sector, we really need to think about, getting more community participation in the process of developing our long-term strategy to live with the COVID-19 until we have a very effective strategy or vaccine who can, prevent it, from spreading again.
Okay, thank you. Any other speakers or, participants would like to share on this? So Professor Fan, you want to speak?
Right.
Or Mr. Chen?
Oh, yes. I would like to answer the number 2, tailored practice can be a recognized way out. I believe so, whether COVID-19 happened or not. This is a way to, this is a good timing to develop what I call smart social work practice for the future, because I think COVID-19 especially pushed us to go further in this way. A lot of information we collected face-to-face or the typical way of filling forms on paperwork has to be digitalized and then make the best use of those information. And I think the social work education have to retrain our social workers in terms of how to turn the information we collected as data. Then it will be better for social work and digitalized services to be developed in the future.
Thank you, Mr. Chen. I see Mr. Edmund Jong raise his hand. Edmund, you want to speak? Edmund Jong, Edmund, you want to speak? No, then Edmund, your turn. Okay, Edmund.
Can you hear
I
me?
can hear you. Yes, yes.
Oh, okay. Thank you. This is Edmund Chung from .Asia. Actually, building on what Mr. Chan was saying, I was curious whether others in the group would think that, I mean, there are certain telepractice or smart services that are being put in place because of COVID-19, but even after the COVID-19, what are some of the learnings that perhaps from the telepractice or other type of technologies that could be actually be used to improve the social work, even with or without the COVID-19? I was wondering whether that is something that is being thought about.
Thank you, Edmund. I think this is a very valid question because actually not only because COVID-19, but actually the social media and the technology has influenced our lives so much. But has our sector or social practice been enhanced or been changed to meet these new maybe challenges or opportunities? I think that's something we should look into in the future.
Yeah.
Yeah, thank you. Anyone else? Well, I see that Mr. Su want to speak. Mr. Su, yes, your turn.
In a way of sort of summarize our discussion, I'd like to raise three sort of issues. One is, as you know,
I think you have switch off the mic of some other device.
The East Asian country overall is highly in a relative sense. Particularly Taiwan is very well. And Korea made the situation quite serious at the beginning because we didn't block inflows from China, but somehow we managed. And so Taiwan case, Korean case, and this Asian experience, documentation, hopefully in English, will be very important. It will be a good reference for the other countries. And the second point I want to make is because of social distancing, the management of the social welfare institution have become very difficult. And the only way out is the use of ICT technology. So the application of the ICT technology in the management of the social welfare institution is a very important issue. This is something where we need international cooperations and some actions in the future. And the third issue is rising inequality. The fourth industrial revolution is resulting in the deteriorating income inequality. And but with this pandemic, the crisis, the situation is getting worse. For example, in Korea, many IT industries and BT industries, they're making record profit. Their stock prices are rising very fast. And so the many people are getting actually richer in the stock ownership, or even the real estate prices rising very rapidly. But many vulnerable, they are in very serious difficulties. So one of the serious issues in Korea is do we have a social safety net right for this kind of situation? And the Korean government gave a sort of a one-time emergency relief, giving cash to everybody in Korea. And the issue of a universal basic income is a debate on this UBI is very hot among the politicians in Korea. So the issue of the sort of a new social safety net or the revision of social safety net in the face of this pandemic is a third issue. So there are a number of very important issues, and I hope we can discuss this one in the future forums. Thank you very much.
Yes, thank you very much. I also see that Professor Joyce Fan also raised another question about whether social distancing will cause a high risk of family violence. We might not be able to answer all these questions, but I think it's good to have these questions, and we can try to solve in the future.
Yeah, actually, President Choi, I like to provide a very short response to the question 4. I don't think the online service can completely replace the online replace the offline services, because actually the majority of our human service are people-centered or person-centered or client-centered services, especially when it deals with emotions, depression and things like that. We encourage people go out and communicate in person. So I think I really agree with the telepractice can improve the quality of services, especially in the impact on the efficiency or effectiveness of human services. But it cannot really, how to say, cure the solve the problem or cure the people's mental illness or the core problems, solve the core problems. So what do we do? How do we overcome this social distance thing? I think 2 things we can do. One thing is we need to equip our frontline social workers with a good and efficient and effective equipment, like enough PPEs and good health habits, like wash your hands and change your mask during the reasonable time. And secondly, actually, for social agencies, there are good supervision systems. I think enhance our supervisory, not power, but enhance our supervisory capacity to empower our frontline social workers are very important during this pandemic time. Because a lot of time, they are, like one of the speakers said, there are worries. There are more worries than facts. So if we can have good like public health education, give people facts, not to worry too much, I think that can reduce the risk of more clients coming up after this social distancing policy. Just for your consideration. Thank you.
Yes, thank you. I think we have more to do. And we have 2 more speakers trying to responding to these questions. I have FURUICHI-san and then Billy Lau. So can we ask FURUICHI-san to speak first?
Thank you. Okay.
Thank you. Thank you.
Sorry, translated. COVID-19 が、 だんだん、収束するに向かって、私たち福祉サービスは変わるものと変わらないものができると思います。
Well, according to overcoming COVID-19 in the future, there is something unchanged, but there are also something to be changed.
COVID-19 がなくなったときに、今までと同じようになるサービスとならないサービスがあります。
Some services can be kept as before COVID-19, but some services must be changed after COVID-19.
で、特に、今お話のあったオンラインあるいは ICT の活用した、オンラインサービスというのは大きな力になると思います。
And in that future society, the online social welfare service using ICT would be powerful support for the social welfare.
しかしながらオンラインサービスが、生活上の問題をすべて解決することにはならないだろうと。
However, it is also impossible that online social welfare service can solve all the problems or issues of social welfare in the future.
人が人にするサービスとオンラインサービスを組み合わせて今よりも質の高い福祉を作るためにはもっともっと実験が必要です。
And to realize an ideal society where both online service and offline service can support social welfare or vulnerable people, we need more research and investigation and maybe some trials.
今日の、ノースイーストエイジアリジョンの、レポートは、その示唆するもの、アイディアがたくさん入っています。
And fortunately, I could learn a lot from the reports of the members of Northeast Asia region.
それぞれの国や地域は、異なる文化や伝統、そして社会資源を持っています。
So each country or region of this area have different culture and different resources.
で、それをそれぞれ今日のアイデアをそれぞれの国の形で生かしていくことがいいのではないかと思います。
So we have to bring up what we learned today to all our own countries or regions and to struggle to find what is the best way for us in the future.
Thank you.
Thank you. Thank you very much. Well, I hope that in the future, maybe we can share more too. Say even in the coming JANG World Conference, if we can say by that time we will have 3 more months experience, maybe we can have more in-depth sharing. Now I have Billy. Maybe he will be the last speaker today. Billy, your turn.
Thank you, Mr. Choi. And I agree with Mr. Furuichi. And I think, sorry, my pronunciation. And I think that future is a mix of online and offline. There is something that we can't replace by online. For example, nursing care, you can't replace it. Escorting, you can't replace it. Medical management, you can't replace it. And some physiotherapies or occupational therapies assessment or things, you can't replace it. But there are many things you can use it side by side. I mean, we can use it as interactively, or you can use it by just instruction, or you watch something. But the most important thing, how to help social workers or practitioners to overcome that. In my observation is that, first of all, they have to overcome the fear. The fear for COVID, and they try to stay back, and then there was many things emotional happening inside, and then you have to overcome it. And first of all, so we try to provide, just like Ms. Joyce Fang said, we have to provide enough equipment for them, protective things, and then real news, not fake news, and how to manage this rumor and things. So this is the first part. And the second part is a fear of for technology. So especially social worker, we are not born in that digital era, especially me. And we are not the, yeah, but the young people is much better. So we have to overcome that fears by some learning or things. And there was some kind of very interesting stubbornness within social workers, is that we try to reach the most difficult people that may not be easy to reach in the very beginning of using the online technology or telehealth or tele something technology. We can't reach that in the first day, but they try to insist that, oh, they are the most needy, they are the most important people that we can reach. So it is 100 marks and 0. And then you can't get 100 marks and you go 0. So what I'm trying to encourage them is that do the one you can reach first. And then on the way you're doing that, you can find solution. And you have to do that bit by bit. You can't get into perfection in one time. So besides device, besides that, is kind of, well, mental change or paradigm shift. So we have to do that. And this is kind of fear or kind of, well, digital literacy or maturity that we have to reach. And the skills you have to acquire, the online skill, for example, we use Zoom. It is not easy, but it's not very difficult. But anyway, we have to adapt to it. And this COVID situation and push us to this. So this is very interesting. Our agency purchased something like Zoom before and it's not successful, but now this is successful. So we are forced to do something, right? And so on the way that I think we have to accumulate what we learn and then exchange more, learn from each other, and we'll be much more mature on this technology or tele practice. So I think I have to mention the Hong Kong Council of Social Service. It has held a very good webinar before, so facilitating exchange between the welfare agency in Hong Kong on telepractice. I think I learned a lot from that. So I think we have to keep that on and then learn from each other.
Sure. Thanks a lot, Billy. And I would like to thank all the participants and the speakers for joining today's webinar. And I think this has been very informative and inspiring. And I hope that we can continue this kind of sharing and discussions in the following months, because I think all of us will expect that the COVID-19 situation will last for some more time. So we have to learn from each other and try to improve our services. So we come to the end of the webinar. I just want to ask you to complete an online survey form, and you can find it. Well, we will show a QR code now on the screen, and you just click to that. Yeah, this one. So you click to this link, and you kindly please answer the questions on it, so that we know your comments on today's webinar and know whether you have any suggestions for us. So thank you very much, and I hope that all of you or all of us will stay healthy, and hope that the COVID-19 situation will get under control very soon. Thanks so much. Thank you. So it's the end of this webinar.